Hi guys, it's Jamie, and I'm now nearly 8 months on testosterone. I wanted to do an update. Basically, I didn't feel like that much has changed. Like I've had that many changes, but one of my friends the other day told me that so I feel like I should do another video. As well, also the other day, I went back to my gender clinic, and this time it was about I had to see two people. I had to see the normal guy that I always see, just for like an update, to see how I was going, and I had to go see another lady I've seen before, but she was going to my second opinion to put me forward for surgery. So this was like a really, to me, really, really important time because the chest surgery is what I'm really, really going for. So I went there, talked to the people, and the lady ended up saying to me, "Look, it's no problem in giving you a second opinion. I can easily decide that. It's not a worry." Kind of just talk me through recovery time for surgery, what would happen next, how much I knew about surgery, which is quite a lot. I spend so much time, looking surgeons up, looking things up, trying to get as much information as possible. Because I was trying to explain, like, my way of doing it kind of was I always try and scare myself so much that I can prove to myself I still want it. Sounds probably a little bit weird. So kind of, I'll look at the most gruesome videos of, surgery happening, surgery going on, or sometimes people where things have gone wrong, and obviously I watch things that have gone right, and good things as well. But I kind of think, as long as I can watch things that have gone wrong, or, like the scary, gruesome videos of, what will happen to me, then if I'm still not scared by that, and that doesn't put me off, then I really think that I feel like I should have chest surgery. So I explained that, and she's saying, "No, that's not weird." So that was good. And they said basically what happens next is that they'll send a letter to the surgeon, who is a guy down in Leicester. I can't remember his name right now, but as soon as I remember his name, I think he's Mr. Ward, but don't necessarily know him that. But as soon as I know for definite, I'll definitely post another video and tell you all. And they're going to post a letter to him, and hopefully within 6 to 8 weeks, I'll get a letter with an appointment on, so I can go see him for an examination. And basically, I don't know. I feel like that's going to be one of the most exciting times. Hopefully, he's going to tell me when he could give me surgery or put me on a list, and he'll check me out. So it should be good. I'm kind of a little nervous because I'm still I've lost quite a lot of weight, but I'm still quite overweight. Apparently, they look for BMI between about 25 and 30. At the moment, my BMI is about 34, but it is going down, so I'm hoping that soon my BMI will be at that optimum place. And what I'm really hoping to hear is going to the surgeon guy, and he'll kind of say, "Oh, we can fit you in at Christmas," but there's obviously no guarantees of that, but that would be just completely amazing, because my person that I normally see when I go to my gender clinic has kind of said that a good time to estimate surgery would be Christmas next year, not this year. But hopefully, because I've lost weight and just because I'm so excited, they're going to say, this Christmas. So I'm really, really hoping that, that goes well and that I'm going to be a good candidate for this person. And also, kind of a little bit of a funny thing, I was talking to my friends yesterday, and, whenever I upload my videos on YouTube, I think, oh my god, yeah, so many people have viewed them, or so many people have subscribed, and makes me feel good. I found out the other day that basically many of my views are just my friends. They like to show the family, which I don't mind. That's cool. Whoever's interested in all that, then fine. As long as helping somebody or kind of teaching people about it, that's good. But so probably again this video is going to be viewed by half my friends. So big shout out to all you guys. Probably Abby's mum, Abby's grandma. Big shout out to you all. But yeah, so I think probably I'll do another video in a few weeks' time when I get something back from the surgeon. In terms of changes, I've generally not noticed actually that many things. The main thing I've noticed is probably about my chest. I feel like, because before I feel like I just had definite boobs, but now I feel like the fat displacement has changed, so I feel like my boobs are probably saggier, but kind of they're easier to hide, which is such a good thing for me. Like obviously, I'm not going to go outside the house with that binder on, things like that, because my boobs, I'm always worrying about my boobs. But I feel more confident, like when I'm outside cutting the grass, wearing a tight sports bra instead of wearing a binder, which was just so painful before. So I'm feeling a little happier with my chest, but obviously nowhere near happy as I want to be. Also, my voice, I think, keeps on getting low. I mean, at the moment I've got a cold, so it's probably helping it quite a lot. But I feel like my voice is still getting lower. Facial hair is still getting thicker and coming in. One side, a lot better than the other, which at the minute, a little embarrassing. And then a weird thing, I don't know if it's necessarily like a true side effect kind of thing, is normally my hair grows really fast. Like, I can go have my hair cut really short, 2 weeks later I've got to go back again. But at the minute, like my hair, it just seems to be growing back very slowly. Like, I haven't had my hair cut for about 6 weeks now, and normally by this point I would have some kind of afro going on. And it's not too bad, so that's quite a cool thing. I'm still waiting for facial hair to go over the front of my face, nothing on the chin yet, or like down the front, just kind of down the sides and underneath. My acne is still getting, still kind of on and off, which to me, like when I went through puberty, the first time, acne was an issue, so I just expected that. A little embarrassing, a little annoying at the minute for me at the minute, really, is chest hair. Like, it's not thick or anything or really bad, but like the odd chest hair, and at the moment I just don't like it, because to me, I've still got the boobs. As soon as I can have a man's chest, then God, give me all the chest hair in the world if you want. But at the moment, I just really don't like it. So, but I'm kind of trying not to shave it or anything, just in case it comes back thicker. So, I don't know. Well, I mean, it's not that much of an issue at the minute. It's nowhere near like that visible to the people. It's only because I can see it quite close up. But that, I'd say like my body shape's still changing quite a lot. Like my fat displacement generally in my body. Like my waist getting smaller. Overall, I think I've lost over 10 inches on my waist just from the fat displacement. I'm losing some weight, so I'm really pleased with that. And then other than that, I'm just general like leg hair, arm hair getting darker, more off. But it's still really good, and I'm really happy with things. So I'll do an update soon, and see you guys soon.